Welcome to Medley and Life. In this video, I am going to discuss about the methanol poisoning. It is the most important repeated short notes and essay, and they'll ask clinical related questions in this methanol poisoning. And we all face the day-to-day life cases related to methanol poisoning. So we have to know about the importance of methanol poisoning. Okay. The methanol is otherwise we called in methyl alcohol, wood spirit, wood alcohol, and wood naphtha. Before enter into the methanol naphthol poisoning or methyl alcohol poisoning starts from objectives. In this video, I am going to discuss about the features and absorption metabolism and the mechanism of action of methanol and clinical features and the diagnosis, treatment, autopsy findings and medical legal importance. First, the methanol is a colorless volatile liquid and it is the nauseating odor and burning taste also. The volatile means when we are open the liquid, it's vaporized. Okay, that is called colorless volatile liquid. And the absorption and metabolism, it is the easy absorption and metabolism. For example, we consume the methanol, it enter into the GIT, and the activation of the alcohol dehydrogenase enzyme leads to formation of formaldehyde. Again, the aldehyde dehydrogenase leads to it form formic acid. The metabolites, the formaldehyde and formic acid is the more toxic comparatively methanol. And I already told absorbed from the GIT, lungs and skin. The metabolites metabolized in the liver. Okay, and it formed the two metabolites, formaldehyde and formic acid. The mechanism of action is metabolites are more toxic, I already told, comparatively methanol. The fatal dose is 60 to 100 ml is enough to die, and the fatal period is within 24 to 36 hours, 1.5 days. And coming to the clinical features, how the patient is coming to present to you means nausea, vomiting, the complaints of abdominal pain, headache, breathlessness, dizziness, vertigo, and tachycardia, hypotension, and profound metabolic acidosis and convulsions, delirium, and coma. And with visual disturbance, blurring of vision, blindness, photophobia, hyperemia of optic disc, and papillary edema and retinal edema. And how should we are going to diagnose? First, it contains a high anion gap, and we have to examine with fundoscopy. Then only we know it affects the eyes or not. And I already told that in clinical features there may be papillary edema, retinal edema, hyperemia of optic disc. We can see through the fundoscopic examination. And lead methanol is more than 50 milligram per 100 ml is highly deadly poison. Okay. And treatment. First, they treat the patient in the quiet and a dark room. Protect the patient eyes from the light, and we have to maintain the ABC. That means respiration, circulation, and blood pressure. And we go for gastric lavage with the sodium bicarbonate. If the patient brought within 2 hours of consumption of methanol, we have to do gastric lavage with sodium bicarbonate. And antidote is ethanol and also fomepizole. Okay, the drug of choice is fomepizole first thing only, then only we go for ethanol. But nowadays we are don't use ethanol because it leads to intoxication and difficulty to maintain the alcohol blood level. What is the action of ethanol in the methanol poisoning? It competes with alcohol dehydrogenase enzyme and it prevents the metabolism of methanol. So it is excreted unchanged in urine. And we used fomepizole. It is the specific inhibitor of alcohol dehydrogenase. It is the drug of choice of methanol poisoning. Okay. The advantage is It is the longer half-life and the lack of intoxication, and it is available in the IV dose form. And we used sodium bicarbonate for correct the metabolic acidosis, and we used folinic acid for folate therapy. It is available in the IV form also. And we have to correct hemodialysis, and we have to correct hypoglycemia with the help of potassium chloride. And coming to the autopsy findings, the autopsy finding shows cyanosis and stomach and intestine may be hyperemic and inflamed. There is a submucosal hemorrhage and pulmonary edema, cerebral edema, retinal edema, and necrosis of myelinated portion of optic nerve. And coming to medical legal importance, it is the mostly accidental poisoning, and sometimes it is the suicidal poisoning also. Thank you. Subscribe to my channel and share to your friends.